Surprisingly, sudden cardiac arrests have become one of the leading causes of death for high school athletes. Many experts believe that many of those deaths could be prevented if effective CPR is performed right away.
If you're there in the first few minutes and start providing that CPR, it's very important. The chances of survival are very high, and that can occur anywhere, whether it's in a building here at the Capitol or out on the street.
For young Morgan Wilson, it happened on a tennis court in Anaheim.
Hi Coach, my name is Morgan Wilson and I'm looking to take my game to the next level and play collegiate level tennis.
Morgan was my daughter. She was 17 and a half years old. She would have been a senior this year in high school. She collapsed from a sudden cardiac arrest on July 8th, and 8 days later she was pronounced brain dead.
Morgan had returned early from a family vacation to continue her tennis practices when she suffered a sudden cardiac arrest.
We got a phone call when we were up the mountains. It said that she had collapsed and we were to get to the hospital immediately. That was probably the worst day of my life.
When Morgan collapsed, there were students and coaches present. One of them did call 911, but no one attempted CPR.
I have nightmares about it daily and nightly, that my daughter was laying there and needing help and no one helped her. For 8 days, we listened to every doctor who would come into her room. Why didn't somebody do CPR? She didn't have a heart problem. She had a problem with her artery. If someone would have done CPR on my daughter, we would have her today, and she would just have to be on blood thinners.
Full CPR course.
Assemblymember Freddie Rodriguez, an emergency medical technician for nearly 30 years before joining the legislature, has proposed Assembly Bill 319, which would require the instruction of hands-only CPR in a class that's required for high school graduation, much like health or PE.
It'll be part of maybe a half an hour course that's already attached to either a PE course or a health-related course. So we're not really looking at changing a whole curriculum, but just adding a little bit more training to students prior to graduation.
Learning hands-only CPR is very easy, says Rodriguez. He's already organized events to teach people how to do it. Learning takes very little time, as shown in this American Heart Association video.
Put the heel of one hand in the center of the chest. Then put your other hand on top of the first.
I need you to do it this fast. 1, 2, 3.
Then push hard and fast in the center of the chest until help arrives.
11, 12, 13, 14, 15.
It's important to push at a rate of at least 100 beats per minute.
An easy way to remember the American Heart Association suggestion: just follow the beat of the song Stayin' Alive.
There's over 20 states in the United States that currently do that. So why can't California? We happen to be the leader of a lot of things. So let's jump on board and also be able to provide that type of education and training and lifesavers for our future.
Debbie and Chelsea Parker, one of Morgan's best friends, have already started helping. They created Learn for Morgan to rally students to learn CPR.
Just watching these kids in these classes, it's fun, it's educational, and like at the end of it, you're gonna save a life.
Morgan's school district has already implemented what the legislature hopes to do across the state.
This Morgan was so healthy. She just had her physical. This can happen to you. Let's stop it from happening to you. We can't have another student die of a sudden cardiac arrest because no one knows what to do.
For those with questions about the cost to implement the legislation, Debbie says this.
Isn't your child worth anything? I would sell my house. I would sell anything I had to get my daughter back. If it meant that I had nothing and I still had my daughter, I would want that. She was funny. Her giggle. I miss it. I miss her giggle, her laugh. Amazing person, amazing soul.
This report was produced by the Speaker's Office of Member Services.